Paronychia. Paronychia is an infection in the skin fold around the nail, usually red, swollen, and painful to the touch. It can be acute or chronic, and most of the time, it hits just one finger. Sometimes there's pus, sometimes it's just tender and inflamed. It often starts from something small like a hangnail, rough manicure, thumb sucking, or even nail biting. And get this, nearly 40% of cases come from contaminated manicure tools. Onychomycosis. Onychomycosis is a fungal infection that messes with your nails, usually the toenails. It makes them thick, discolored, brittle, and sometimes they even start to crumble. Most of the time, it's caused by fungi, like trichophyton, but yeast or mold can do it too. It usually starts at the tip or side of the nail, but in some cases, it creeps in from the base, especially in people with weak immune systems. Toenails are way more likely to get infected than fingernails, almost 10 times more. So yeah, if your nails turn yellow and feel like chalk, it's probably this: nail psoriasis. Nail psoriasis happens when your immune system starts attacking your own nail cells by mistake. It's the same condition that affects the skin just showing up in your nails instead. You might see tiny pits, yellow patches, or the nail pulling away from the skin. Sometimes the nail thickens, crumbles, or gets a chalky buildup underneath that makes it feel tender. It can even change shape or color like it's trying to grow in the wrong direction. Yeah, your immune system can get real creative. Onycholysis. Onycholysis is when your nail starts lifting off the skin underneath, usually from the tip or side. It doesn't hurt, but it leaves a weird white or yellow patch where the nail used to stick. It can happen from things like nail trauma, fungus, skin conditions like psoriasis, or even thyroid issues. Sometimes it's just from too much exposure to chemicals like harsh soaps or nail polish remover. The nail might thicken, change shape, or get crumbly, but it usually starts out painless and just looks off. Brittle nail syndrome. Brittle nail syndrome is when your nails start splitting, peeling, or crumbling way too easily. They get weak, thin, and sometimes feel soft or dry depending on what's causing it. It can be from aging, too much hand washing, harsh manicures, or even health issues like thyroid problems or iron deficiency. Sometimes it's just how your body makes keratin, no clear reason at all. If your nails crack like chips or peel like paint, it's probably this. Onychorrhexis. Onychorrhexis is when your nails grow with long vertical ridges, those thin lines running from bottom to top. They can feel rough, look split, and break way too easily. It happens more with age, but can also be linked to things like poor nutrition, thyroid problems, or skin conditions like eczema and psoriasis. Chemical exposure and nail biting can make it worse too. If your nails feel like they're growing in stripes and cracking for no reason, that's probably it. Koilonychia, also called spoon nails, is when your nails get so thin and soft, they actually dip inward like a little bowl. In some cases, they can even hold a drop of water. It's usually a sign of something else going on, like iron deficiency, anemia, or other health issues. The nails become fragile, grow slower, and sometimes even crack or peel. If your nails are curving in instead of out and you're feeling extra tired, it might be more than just a nail problem. Beau's lines. Beau's lines are those horizontal grooves that run across your nails like dents that move forward as your nail grows. They show up when something interrupts nail growth at the root, like trauma, illness, or even harsh manicures. You might notice one line or several depending on what caused it. They're different from those vertical ridges you get with age. If you spot a deep groove reaching the tip and it feels sore, that's probably Beau's. Onychomadesis. Onychomadesis is when the nail starts lifting off from the base and eventually falls off completely. It happens because the nail temporarily stops growing, usually after illness, infection, or trauma. You might see grooves or ridges first, then one day, the nail just lets go. It's usually not permanent. New nail growth kicks in after a few weeks or months. Scary to look at, but most of the time, it heals on its own. Retronychia. Retronychia is when the nail grows the wrong way, literally backward into the skin at the base. Instead of pushing forward, the new nail gets stuck under the old one, causing swelling, pain, and sometimes infection. It mostly hits the big toenails and feels like pressure that just won't go away. You might see thickened nails, yellowing, or signs of paronychia around the cuticle. It's usually caused by repeated trauma like tight shoes, stubbed toes, or even downhill walking. Longitudinal Melanonychia. Longitudinal melanonychia shows up as a dark stripe running from the base of the nail to the tip like a brown or black band painted down the middle. It's usually harmless and more common in people with darker skin, but in some cases, it can signal something more serious. That's especially true if the stripe is new, getting wider, or looks uneven. Sometimes it's from trauma, friction, or even medication, but in rare cases, it can be a sign of melanoma under the nail, which needs urgent attention. Bottom line, if a dark line suddenly shows up and doesn't look right, get it checked. Green nail syndrome. Green nail syndrome is exactly what it sounds like. Your nail turns green. It's caused by a bacteria called Pseudomonas, which loves warm, wet places. It usually shows up after nail trauma or onycholysis, when the nail lifts and moisture sneaks underneath. You'll see a green, blue-green, or even blackish tint, and sometimes it smells a little funky too. It's more common in swimmers, dishwashers, and anyone with constantly wet hands or feet. Leukonychia. Leukonychia is when white spots, lines, or patches show up on your nails. Sometimes it's just a tiny dot from bumping your nail, other times the whole nail looks pale or cloudy. Most of the time, it's harmless and fades as your nail grows. But in some cases, it can point to things like nail trauma, fungus, or even health issues like anemia or liver problems. If the white part stays when you press on it, it's part of the nail itself. If it fades, it's probably coming from underneath. Clubbing. Clubbing is when your fingertips get round, bulbous, and the nails start curving downward, kind of like an upside down spoon. The nail beds feel soft or spongy, and the usual angle at the base of the nail disappears. It doesn't happen randomly. Clubbing is usually a sign of something going on inside, like lung disease, heart problems, or even liver issues. It can build up slowly over time, and in some cases, it actually goes away once the underlying condition is treated. So if your fingertips start changing shape, it's not just a nail thing, it's a signal worth paying attention to. Yellow nail syndrome. This one's rare and serious. Yellow nail syndrome shows up with thick, yellow, slow-growing nails. They might curve, lose their cuticle, or even lift off the nail bed, but it's not just about nails. It also comes with swelling in the legs called lymphedema, and breathing issues like chronic cough, sinus infections, or fluid around the lungs. Doctors aren't totally sure what causes it, but it may be linked to immune problems, titanium exposure, or even some cancers. There's no cure, but some treatments help. And the nail changes? They usually stick around.